The part of this that I take, the part of the safe exam process that I do have the most respect for and that is the most emotionally challenging is this aspect that patients will remember this minutes and hours for the rest of their lives. And you know that every gesture you do, every way you touch them that is seen as inefficient or hurtful is going to be remembered by that patient. And I know that for all physicians who are then, especially those who are not trained, when there's a sense of that it's not, and that's what makes it hard. It's not the steps that are hard, it's just that you know that the impact of everything you do is so great. In the emergency department, when a sexual assault victim comes in, there is a realization that if it's going to be you who's responsible for doing that exam, it is going to take a lot of time and a lot of patience. And all those other tasks that are being done simultaneously by you, and multitasking is inherent to emergency medicine, all of a sudden get put on hold. My role, my main contribution is to actually get physicians excited again about the idea of why it's important in emergency medicine to, when a patient comes in who is a victim of a sexual assault, why that is not a distraction from your emergency medicine task, but is actually integral and is actually an example of what emergency medicine actually is all about. I found myself in this field almost by accident. I had a very blessed childhood growing up. My parents were very young when they had me, and I had often it felt a big sister for a mother. I have no siblings, so she ended up being my big sister. Growing up, I did not know that I wanted to be a doctor until very late.
What did your father do?
My father is a physician in internal medicine. When a woman is a victim of a sexual assault, the most important thing is for her to realize there are options for her. And the place where there are the most options is going to be in the emergency department. The emergency department is going to be able to provide them with not only the physical exam, which we talked about, but that's only a part of it. There are social workers, there are advocates that are going to help them to know about the options that will go well beyond the emergency department visit for the weeks, months, and maybe even years. It will also help them with a difficult legal process to understand it, so they can understand when they tell the police, do they have to tell the police? What will happen if they do tell the police? What are the options for protection if they do know the person who may have committed the sexual assault? How can they be protected from that person? We can help them in the emergency department. More than any other place, we have the personnel that can give them that information, especially in a safe, designated center where we have people who have more experience and who know these options better than anyone else.